Assalamu alaikum. Hello my dear student. Hope you are doing good. I am Dr. Karim Rezwan Hasan, Associate Professor, Department of Anatomy, Ad-Din Women's Medical College. Today I will show you the video of the dissection at the posterior compartment of the thigh and also the gluteal region. If possible, we will see the popliteal fossa as well. As you know, dissection is one of the very important part in the anatomy because whenever you are giving exam in front of a dissected body, you have to make sure that you know every single steps of dissection because your teacher will ask you about the procedure of the dissection. At the same time, you have to make sure that you know each and individual structure of the dissected body. So before proceeding to the dissection, we have to know that what are the layers that will come whenever you are doing the dissection. In the extremities, after the skin, a very thin layer of the superficial fascia is there. And at the superficial fascia, there will be superficial vessels and nerve. We also call it subcutaneous vessels and nerve. Remember, these subcutaneous vessels and nerve are very much delicate, and that's why you have to preserve them very carefully. Just after that, in case of lower limb, we are having a deep fascia. Sometimes it is very difficult to identify the superficial fascia from the deep fascia. Superficial fascia is mainly composed of fat. On the other hand, the deep fascia is composed of fibrous connective tissue, which is little bit white in color. Now this deep fascia in case of lower limb is called the fascia lata. After removing the fascia lata, you will see the muscles. We will see step by step the procedure of dissection as well as the muscles. And you know that lot of vessels and nerves are present over there. We will have to identify them. So let's start. So over here you can see the dissection procedure of the gluteal region. We can see the gluteal region over here. This is the lateral aspect. This is the medial aspect. This is the superior aspect, and this is the inferior aspect. We have given skin incision at the midline. At the same time, we are giving another incision, an oblique one, below the gluteus maximus. Then we have reflected the skin, which is very thin over here, preserving the fibers of the gluteus maximus over here. We can see that along with the skin, there are superficial fascia and the deep fascia. So this is the biggest muscle, which is the gluteus maximus, and over here you can see that this area, which is a little bit white in color, this is the iliotibial tract or IT band. You know that this iliotibial tract is present at the lateral aspect of the thigh, and it is the condensation of the deep fascia or fascia lata, which is having two muscles. One is gluteus maximus from the posterior aspect, another one is tensor fascia lata, what we have already discussed in the anterior compartment of the thigh. Now you have to make sure that whenever you are dissecting the gluteal region, you have to remove the gluteus maximus muscle to see the underlying structures. Because the gluteus maximus muscle is so big, it is hiding the other structures which is present underlying the gluteus maximus. The main function of the gluteus maximus is extension of the hip joint, and it is supplied by the inferior gluteal nerve. As we can see that by a midline incision, we are reflecting the fibers of the gluteus maximus muscle over here. Be sure that whenever you are reflecting the gluteus maximus, you are preserving the other structures. Over here we can see this is the gluteus medius muscle. The main function is the abduction of the hip joint, and the supply is superior gluteal nerve. Then underlying the gluteus medius muscle, another muscle is over here, which is the smaller one, and it is the gluteus minimus. Now this gluteus minimus is having the same nerve supply just like the gluteus medius, which is the superior gluteal nerve. So, three muscles, one after another. Gluteus maximus, nerve supply is the inferior gluteal nerve. Gluteus medius, nerve supply is the superior gluteal nerve, and the gluteus minimus, the supply is superior gluteal nerve as well. Now, you can see this region is also having some other structures. There are some muscles which are called deep gluteal muscles. These deep gluteal muscles are present deeper portion of the gluteus muscles. So, we are zooming a little bit to identify those muscles. Over here, you can see this muscle, a tendinous muscle which is called the piriformis muscle. This is the tendon of the piriformis, and you can see it is transversely present over here. Below the piriformis, there is another muscle, very small muscle, which is called the superior gemellus muscle. This is called the superior gemellus or gemellus superior. Then below it, another muscle tendon can be seen, which is called the obturator internus. This is the tendon of the obturator internus, and below the obturator internus there is inferior gemellus muscle. So, you have to make sure that above the obturator internus there will be superior gemellus, and below the obturator internus there will be inferior gemellus. And most below this quadrangular muscle, which is known as quadratus femoris. So, you can see quadratus femoris as well. Deep to the quadratus femoris, we will find obturator externus, which is right now hidden by the quadratus femoris. So, these are the area which is having all the deep muscles. The main function of the deep muscles of the gluteal region are lateral rotation of the hip joint, and they are supplied by the branches from the sacral plexus. So, whenever you are dissecting the gluteal region, you have to make sure that you are identifying each and individual deep muscles as well. Now, let us see some other structures. These are the vessels which are present above the piriformis muscle. Above the piriformis muscle is the superior gluteal artery, superior gluteal nerve, and both of them are coming through the greater sciatic foramen above the piriformis muscle. So, we can see these are the vessels, and this is the nerve, superior gluteal nerve. Those are the vessels, that means artery and vein, that is superior gluteal artery and vein. And this foramen is the greater sciatic foramen. On the other hand, below the piriformis, you can see inferior gluteal nerve is over here, and the inferior gluteal artery and the vein as well. So, below the piriformis, inferior gluteal artery and vein, and also the inferior gluteal nerve. Now, this very thick nerve which is coming below the piriformis is the sciatic nerve. Obviously, it is coming out through the greater sciatic foramen over here, and you know that this sciatic nerve is innervating the posterior compartment of the thigh. Now, we will see what are the muscles which are present at the posterior compartment of the thigh. Over here, we have given a vertical incision extending from the previous incision up to the posterior aspect of the knee joint. Then, we are reflecting the skin. Before doing that, you have to make sure that whenever you are giving the skin incision, it has to be very much superficial, so that you are not doing any sorts of injury to the deeper structures. This is the skin with the superficial fascia, this is the deep fascia, also known as fascia lata of the thigh. As we can see, these are little bit whitish structure due to the fibrous connective tissue. Now, there are some muscles over here. We will identify these muscles. These muscles are called the hamstring muscles, the muscles of the posterior compartment. This muscle is the biceps femoris muscle, which is having two heads, long head and the short head. On the other hand, over here you can see that this is the semitendinosus muscle. Semitendinosus mean that half of it is tendinous, as we can see. This is the semitendinosus muscle, and it is resting on another flat muscle which is very much flat, but half of it is membranous, it looks like. So this is the semimembranosus muscle. As we can see, this is the semimembranosus muscle. So laterally we have found the biceps femoris, and medially we have found the semitendinosus along with the semimembranosus muscle. It is half membrane because it says semi means half and membranosus. Now, whenever we are identifying these structures, you can understand that they are doing some particular functions. Biceps femoris, long head, is doing the knee flexion and the hip extension, and the short head is doing the knee flexion. On the other hand, semitendinosus and the semimembranosus both are doing the same kind of function. That means they are doing the flexion of the knee joint and extension of the hip joint. Now these hamstring muscles are basically coming from the ischial tuberosity over here. You know the ischial tuberosity is present at the hip bone. From the ischial tuberosity, these muscles are going and they are extending up to the leg. Remember, long head of the biceps femoris, semitendinosus and semimembranosus is doing the same kind of function, and biceps femoris is mainly the powerful extensor of the hip joint and also the flexion of the knee joint. Over here you can see it is going to the lateral aspect of the leg. Now let's see the boundary of the popliteal fossa along with some structures. This region is the popliteal fossa. So over here we can see that laterally the biceps femoris is present, and medially over here semitendinosus and semimembranosus is present over here. So at the superior aspect or superior laterally, biceps femoris, superior medially will be semitendinosus and semimembranosus. Now let's see what about the inframedially and the infralaterally. The inframedially, there will be medial head of the gastrocnemius, and infralaterally there will be lateral head of the gastrocnemius. Gastrocnemius is a muscles of the leg, posterior compartment of the leg, which is also known as the calf muscle. Now over here we can see sural nerve over here, that is the tibial part of the sural nerve, you can see, and sural communicating nerve is over here, as you can see over here, and this is the small saphenous vein which is present at the posterior aspect of the leg. Now innervation of the posterior thigh is mainly done by the sciatic nerve, as we have seen that this is the sciatic nerve that is extending and coming out from the pelvic region through the greater sciatic foramen. And interestingly, this sciatic nerve, after coming down, it is divided into two branches. One is tibial nerve and another one is the common peroneal nerve or common fibular nerve. You can see this one is the tibial nerve, which is present at the mid portion, and another one is going a little bit laterally close to the fibula, and that is the common fibular nerve or common peroneal nerve. This one is little bit thinner branch and the tibial branch is little bit thicker branch. Now this common peroneal nerve is again divided into superficial and the deep peroneal nerve. The superficial peroneal nerve, as you know, will supply the lateral compartment of the leg, and the deep peroneal nerve will supply the anterior compartment of the leg. So you can see this is the common peroneal nerve or common fibular nerve. It is going to the lateral aspect of the leg. Over here there is neck of the fibula. It will cross the neck of the fibula over here. And this is the tibial part of the sciatic nerve, which is one of the most important component of the popliteal fossa. And it is passing to the two head of the gastrocnemius over here. Tibial nerve itself is supplying the semitendinosus, semimembranosus, and also the long head of the biceps femoris, as we can see. And the common fibular nerve or common peroneal nerve is supplying the short head of the biceps femoris. And we already know that long head of the biceps femoris, semitendinosus, semimembranosus is supplied by the same nerve and doing the same kind of function. Right now we can see the blood supply of the posterior compartment of the thigh. Over here we can see this is the perforating branches of the deep femoral artery or arteria profunda femoris. These branches are coming to supply the muscles of the posterior compartment of the thigh. Over here we can see some structures deep to the posterior aspect of the thigh. One seems a little bit whitish in color and another one is a little bit darker. Now what are these structures? This is the popliteal vein, which is the continuation of the femoral vein, and it passes through the adductor hiatus. And this one is the popliteal artery, which is deeper to the popliteal vein, and it is the continuation of the femoral artery, and it will pass through the adductor hiatus as well. This is the adductor hiatus through which they are coming and going in. So over here we can see that this artery, after going to the popliteal region, it will give some genicular branches to supply the knee joint just in front of the popliteal region, and also it will be surrounded by some soft tissues over here. You can see some soft tissues over there. This is another branch, that is the genicular branch. What is this structure? What are the lateral division of this structure? Yes, you know that this is the sciatic nerve. The lateral division is the common peroneal or common fibular nerve. Now, what is this structure and what is the blood supply of the posterior compartment of the thigh? You know that perforating branches from the profunda femoris artery will supply the posterior compartment, and this is the semimembranosus. You know the function of the semimembranosus, and it is also supplied by the tibial part of the sciatic nerve. The function is flexion of the knee joint and extension of the hip joint. Now over here you can see two muscles are over here. Number 4, what muscle? Try to guess after reflecting the gluteus maximus. This is the gluteus medius muscle, and the function is abduction of the hip joint, and the nerve supply is the superior gluteal nerve, and this muscle is the piriformis. As you can see, it helps for the lateral rotation of the hip joint. Now over here you can see The sciatic nerve is divided into two branches. This is the tibial nerve and this one is the common peroneal nerve. Now over here you can see gluteus maximus and the long head of the biceps femoris. The gluteus maximus is supplied by the inferior gluteal nerve and the biceps femoris is supplied by the tibial part of sciatic nerve. You already know their functions. Just tell me what are their functions. Yes, gluteus maximus, hip extension and long head of the biceps femoris, knee flexion. So my dear students, you have already seen that how we have dissected the posterior compartment of the thigh as well as the gluteal region. So you have already seen that what are the arrangement of the different muscles and the nerve supply and the blood supply and how they are arranged in the posterior compartment. Not only that, you have seen the structure that is present underlying the gluteus maximus muscles as well as all the muscles with their functions. So in the coming days, we will see some other dissections of the lower limb. Till then, stay safe.